Hi everyone, my name is Nicole Brown and I am an intensive care registered nurse here in Niceville, Florida. And today I just want to talk about the image of nursing. So what exactly is the image of nursing? Well, it's how other people see us, whether it's other healthcare professionals, whether it's our patients, whether it's the general public. How do they see us? So I did some research and came across a medical journal. And in this journal, I found an article titled The Nursing Profession, Public Image, Self-Concept, and Professional Identity. And in this article, in regards to other healthcare professionals, especially doctors, we are still seen as their shadows or their personal handmaidens. We're not capable of making our own decisions in regard to patient care. That's absolutely ridiculous, isn't it? I don't know if you guys can remember that show, The View, not too long ago. Joy Behar had made that ignorant comment about how stethoscopes were only for doctors and she had to eat her words. But unfortunately, in other places around the world too, traditionally, nurses are seen as a low social status profession. Also too, they're seen as predominantly female. And when it comes to a whole nother topic, we can get onto gender stereotyping. Nursing is still seen as a predominantly female position. There are a lot of male nurses out there, but men in the nursing profession are seen as the second sex. Then we have shows like Grey's Anatomy or House, where you have these beautiful young nurses that are falling all over themselves in regards to these handsome, genius doctors. You know, it's like, come on, guys, wake up here. And then you have films or YouTube videos where they objectify us as these sexy objects or these angels of mercy or self-sacrificial heroines. It's just completely distorting our image in the public eye. They already have a misconception of nursing that it's tedious or it lacks creativity, it lacks a challenge, it lacks responsibility, but yet at the same time we're paid super high wages and we work in these super comfy, cushy working conditions. And I'm like, what hospital do you guys work at? But anyways, the media also tends to leave out what is required to be a nurse. They tend to see us as having limited opportunities in this profession. These negative thoughts are also impacting our code of ethics. So Provision 5 basically talks about how the nurse owes the same duties to self as to others. Well, guess what? We have to take care of ourselves before we take care of anyone else. Physically, emotionally, spiritually, mentally, professionally, we have to take care of ourselves. We are number one. And it's like we know how hard it was to get into this career field. We are skilled, competent professionals, but then we have things like staffing shortages, we have lack of time, we have customer satisfaction scores that are affecting the quality of care that causes strain. They're causing burnout. They're causing us to feel meaningless. These negative stereotypes cause us to feel less valuable, underappreciated, and it decreases work morale. Then you have Provision 6, where the nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment. No matter what, we have to do what is right. We have to create a safe space where quality care can be given. And we have to work together as a team with doctors, with other healthcare professionals, and embody a mutual respect. No one is better than anyone else. We have to all embrace each other and be kind to one another in order to provide the best quality of care. And this article also talked about what we have to do in order to change these stereotypes. It is our responsibility to educate people. when negative comments are made, we have to respectfully educate them. We need to stand up for ourselves instead of just letting things roll off our backs. Reach out to communities, educate them on the profession, educate them on the vast opportunities that nursing can provide you. There is not just one type of nursing. It just saddens me that on one spectrum, we are recognized as the most trustworthy assets in healthcare, but then at the same time, we're diminished to low-educated, subservient occupation, not even a profession. And I think this article really speaks volumes on our appearance. I believe it was a great source of information. The evidence, they chose several citations to research, and they expanded it across the world. So if anything, I encourage you to educate others and to speak up for us. Don't let anyone discredit what we do. And this pretty much concludes my discussion on the image of nursing. Thanks for listening. Bye.